Hello, good morning, good afternoon to everybody. Thank you very, very much for joining today's webinar. This is one in a series of webinars from the Health and Wellness pillar of the CGF. And I'm really thrilled today that our member Walmart is going to be hosting this webinar and sharing insights with you on the emergence of retail healthcare. And this is something that we really welcome from all of our members as best practice sharing from your company. So if you'd like to do a webinar, please do feel free to contact me. So today's speaker, who I'm delighted to introduce from Walmart, is Alex Hurd. And Alex is Senior Director of Health and Wellness at Walmart. And he is going to be sharing with us his learnings of how Walmart is driving this exciting development of retail healthcare services. You're going to hear more about the emergence of retail health fairs as a prominent trend in the US healthcare market. We're going to see as well how you can potentially participate in this retail health phenomenon. And we really welcome your active participation in today's webinar. So you'll notice that you're all on mute. Just for sound quality during the webinar, but there will be plenty of opportunities to ask questions at the end of Alex's presentation. So you can see on your screen on the right-hand side, you have a small control panel where you can send questions directly to me and to Alex, so please feel free to do that during the session. You also have the possibility of sending me an email to s.bly@theconsumergoodsforum.com, and we'll be happy to get back to your question either during the webinar or afterwards if something comes to your mind. We'll also unmute all of the phone lines at the end of the webinar, so plenty of opportunities to discuss and dialogue with Alex. So on today's agenda, I'll just give you a quick context of the health and wellness pillar here at the Consumer Goods Forum. We're going to have a look at this emergence of retail health. Alex will give you some insights and learnings on why Walmart, why this is important to Walmart and their consumers and shoppers. More insights on America's biggest health fair and some of the experiences that Alex and his team have had in recent events in Walmart stores. We look at how healthcare has really begun in the retail environment and in store, and how you can get engaged, whether you're based in the US or outside the US. It's all about best practice sharing and collaboration and seeing how retailers and manufacturers can work together to better people's health. And of course, here on your screen, you can see my email, s.bligh@theconsumergoodsforum.com. So feel free to get engaged. So before I hand you over to Alex, just a very quick overview of the Consumer Goods Forum, so who we are and what we do. So here on the screen, you'll see what we're all about. Our strategic pillars are all about working together efficiently for positive change. The Consumer Goods Forum is all about positive action and collaboration between retailers and manufacturers. And we're governed by a board of directors of 25 retail and 25 manufacturer CEOs. And these CEOs have selected these 4 areas for us to really work together on collaboratively to drive positive change and business efficiency. So there's sustainability, product safety, health and wellness, and end-to-end value chain and standards. And at the bottom of our house, our mandate really is knowledge and best practice sharing. This webinar is part of that mandate. So I am Sharon Bly, and I am Director of the Health and Wellness pillar here at the Consumer Goods Forum. And you can see here, this is our house, what we work on. We have a steering committee of 30 executives who really oversee the strategy of the Health and Wellness pillar. And our vision is really to empower healthy consumers globally. And we really have that mission to work together as retailers and manufacturers to support healthier lifestyles. So it's all really about helping people to make informed choices, having a positive impact, and everything we do is about retailer and manufacturer collaboration. So when we set the foundation for this house, we came together in 2011 and we set 3 resolutions. So these really are the foundation, the basis for everything we do in the health and wellness pillar, and these were adopted in 2011. And really what part of my mission is to really encourage implementation of these health and wellness resolutions across the 400 member companies of the Consumer Goods Forum. So we really work with our members to help them drive their health and wellness strategies around access and availability of products and services, around product information and responsible marketing, and about communication and education about healthier diets and lifestyles. And the full set of resolutions and guidelines are available on our website if you want to have a look in more detail, and I'll give you that link at the end of the webinar. So in 2014, with the members of the Health and Wellness Steering Committee, they made a proposal to the Board of Directors to look at 4 areas where we thought we could make public commitments for the industry to really bring more focus to our agenda. And these commitments that you can see here on the screen, they're part of our 5-year plan to become a key partner of choice in the global health and wellness agenda. So we're working on making company policies on nutrition and product formulation public by the end of 2016. And we're also working across the membership to help and encourage and support all of our members to implement employee health and wellness programs across the CGF membership in 70 different countries. So we have the possibility to impact a lot of people, our own people, and this is something we're driving till the end of 2016. We also made a commitment on consistent product labeling and consumer information, so providing transparent, fact-based information to consumers to help them make an informed choice. And we also agreed to stop marketing communications to children under 12 for food and beverage products that don't fulfill specific nutrition criteria. So we're working with our retailers and manufacturers on driving this until the end of 2018. And one of the areas where our steering committee really wanted to work on this year, and why this the subject of today's webinar is very important to us, is we thought about how can we really bring these commitments to life at a community level. So we looked at retailers and manufacturers and how they really reach the lives of people on a daily basis all over the globe. All of you do. And you really have a fantastic role to play to improve community health. So we looked at what our member Walmart is doing and some of the fantastic things that they're really doing and they're implementing in their stores and their businesses to bring their health and wellness goals to life in the community. So great example today of what one of our retailer members can do, and we hope will inspire others to get involved and to collaborate on looking after our shoppers, our consumers, and our employees. So that was a quick background information on the CGF pillar and what we're trying to achieve. And I will now hand you over to Alex to give you more insights on how this is all happening on the ground and being put into action at Walmart. So Alex, I'll hand it over to you.
Thank you very much, Sharon. Good morning, good afternoon, good evening, everyone. Thank you very much for participating today. My name is Alex. Some quick background on myself. My father is American. My mother is Italian. I grew up in Germany. My wife is from Mexico, and my son spent the first years of his life in Vietnam. I've been with Walmart for 3 years and absolutely love it. Our mission to be the #1 retail provider of affordable health care in the U.S. is absolutely awesome. Sharon, could you go to the next slide, please? And so let me speak briefly about the emergence of the retail health phenomenon. And when we say retail health, really this is more than your traditional retail pharmacy. Retail health is really a combination of healthcare related services and products in innovative ways that seeks to engage customers and communities around healthy behaviors, and doing that by engaging them in places where they are already congregating. And so Drugstore News, which is a very prominent publication, industry publication here in the U.S., dedicated an entire section to health fair events in their February edition. And it spoke to programs that a lot of different entities are doing, whether that is Walgreens, CVS, Sam's Clubs, Rite Aid, Costco, really highlighting how many of the leading players in this space have really embraced this phenomenon. And going back to last year, the Food Marketing Institute issued a report really talking about how retail is driving a lot of community services for customers in a big way, whether that's product sampling or community health events that sometimes even include store tours where you're teaching customers how to shop for healthy products. And then finally, if you look at the big three, let's say, players in the retail pharmacy space, you can see that, across the board, the assortment of services has expanded substantially from pharmacy per se, where all of the top players are also offering services such as immunizations, health screenings, clinics, as well as support for enrolling in health insurance. And we'll come back to that later, a little bit later in the presentation. So, as we look at the emergence of retail health, it's important to understand the underlying factors that are really driving this trend. Sharon, if you could go to the next slide, please. And what we're seeing and what we have seen over the last few years are some dramatic changes in the U.S. healthcare system, many of which can be tied back to the Affordable Care Act brought forward by the Obama administration, which gave all citizens and residents the right and obligation to health insurance. And I know for many of the participants in Europe and Asia, the concept of not having health insurance is very foreign, because I know in many places we take it for granted that this is something the government provides, but really in the U.S. market and the U.S. system, it was a novel kind of development that took place, and but the effects are of the change in the system, in some cases are almost counterintuitive. And so, as the slide shows, over the last 5 years, you've seen a pretty dramatic reduction in the uninsurance rate. You have between 20 and 30 million Americans that have gained access to health insurance since 2012, but yet the rate of participants, or the rate of individuals, I should say, who put off treatment due to cost has actually, as you can see, stayed very consistent over the same period of time. And that's really driven by several factors that we can see on the right-hand side. Because what you'll find is, even though the rate of uninsurance, or the rate of insurance, has gone up, there has also been a dramatic change in the way health insurance is structured. And so what you've seen here since 2009 is a 300% increase in so-called high deductible plans. And what that means is essentially for a large number and growing number of Americans, even though let's say you have health insurance, the first 2,000, the first 3,000, the first 4,000, the first $5,000, depending on which plan you pick, of healthcare related expenses actually are out of pocket. And so even though a lot of folks now have insurance, in some cases they're actually spending more on healthcare expenses because coverage has essentially been reduced. And so you'll see some very important trends. Then, we talked about the 300% increase in high deductible plans. You see a 20% increase over the last 4 years in terms of the amount of deductible. So really that rising from, from let's say $2,000 to $3,000, and $3,000 to $4,000, and higher in some cases on deductibles. And underpinning that is the cost for medical expenses. The rate increase for medical expenses is growing far faster than the rate of inflation. And so all of this is leading to pressure on the consumer in terms of healthcare expenditures. Next slide, please. At the same time, a lot of the underlying problems affecting the U.S. healthcare system weren't really addressed by the Affordable Care Act, and if anything, were augmented by creating more strain on the system from new individuals entering the healthcare market. And really, those strains can be summarized in terms of geographical access. So 1 in 5 Americans lacks access to a primary care provider. And that's especially a problem in poor and rural communities. But even in places where, let's say, customers and patients have geographic access, there is a lack of what I call practical access, which is doctors' offices, let's say, are all open 9 to 5, but let's say you're a family of 3, and both you and your spouse work multiple jobs, and you have a child that is sick. It becomes difficult to access the doctor during working hours, right? And we talked at length then about the costs associated with accessing primary care and other specialist services. And underlying all of this, these problems, is a lack of what we can say basic health education and coordination across the system. How do I get started with accessing the healthcare system? Where do I get my prescriptions? What foods are really healthy options for my family and I? And so all of these factors combined, continue to put a lot of pressure on the consumer in the U.S. To participate really effectively in health care. And that's why, if we can go to the next slide, if you look at why Walmart is starting to lean in far more heavy in healthcare, it is because our customers are telling us that they need help. In the U.S., the #1 driver of personal bankruptcy is healthcare related expenses. And healthcare across the board for all our customer households will be among the top 3 areas of concern. Now, health and wellness also fits in very well into our overall mission, right? Our overall mission is to save people money so they can live better, right? And so the health and wellness component really, speaks to the second part of the mission, which is the live better. And I spoke to our vision of becoming the #1 retail provider of affordable health care, because there is such a great need in right now in the U.S. for it. And so our strategy is really focused on increasing access and increasing our assortment to health and wellness services and products. Continue to drive prices down wherever we can, and to deliver the highest quality of services. Next slide, please. And from a public health perspective, at the macro level, it makes a lot of sense. If I put in my public health hat for a moment, if we can start offering more health and wellness services to the broad public, to Walmart shoppers, well, the reality is that Walmart shoppers are a mirror image of the American consumer in terms of the key demographics of age, income, household size, ethnicity, and child household size. And with over 140 million visits to our stores per week, offering more services within stores makes a lot of sense if you really believe in the mission of driving significant changes in behavior for a significant portion of the population. Next slide, please. And so what we are doing is looking at our existing portfolio of offerings, whether that's the pharmacy, which in our pharmacies we offer prescription medication, but across the board, all our pharmacies are offering immunization and counseling services as well. We have a broad assortment of over-the-counter medication. Right now in the American market, 1 in 3 over-the-counter medications is purchased at Walmart. In 3,000 stores, we have vision centers where you can come in and see an optometrist for vision screenings, and we also offer a broad assortment of glasses. A lot of folks don't realize, but we actually manufacture glasses here in the U.S. So this makes it a very interesting business for us. Primary care clinics. So we have opened 18 primary care clinics across 3 states, Texas, South Carolina, and Georgia, because what we have found is, unlike Europe or Asia, there really is no a broad primary care system here in the U.S., which has the consequence that in many cases when people do not visit a primary care doctor, an ailment can become, or in many cases becomes worse without being treated, and the result is a visit to the emergency room, which is very costly and so is driving a lot of strain on the overall system. In our stores, Walmart is also the largest grocer in the U.S. and so the largest seller of fresh products and healthy foods. and we offer sporting goods and electronics, and also a lot of financial health or financial products through our money centers. For example, the ability to pay health insurance. And so, you know, this slide really demonstrates all of the different assets, you know, retail health assets that we have, but it hasn't been until the last 2 years, next slide please, where we have really started to tie together all of those assets. And so examples such as America's Biggest Health Fair, where we offer free screenings to customers in stores, free screenings for blood pressure and free screenings for glucose to monitor diabetes, are really ways to highlight, you know, not just the pharmacy, but then also the fresh food options and healthy food options we have in the store. Healthcare Begins Here is our platform to help customers identify which health insurance options are best for them, and then help them to enroll in that health insurance. Because the journey throughout the American healthcare system is very complicated, as I hope that you have been able to see through this presentation. And it often begins not when an individual is sick, but much earlier when you make a financial decision on which health insurance to select. And so by offering a health insurance enrollment solution, we have met really a key need in the market for customers to really start engaging with the system and with their own health. I spoke briefly about the Walmart Care Clinics, which we're very excited about expanding in the coming years. We've also taken steps through our Every Little Step program to create a comprehensive baby solution, where insurance companies and employers can offer their members everything from folic acids and multivitamins to breast pumps and car seats and sample boxes during every trimester, and then breast pumps and car seats post-delivery, to really create a comprehensive solution to keep mom and the baby healthy. We have created a solution called Great For You that really highlights in store which products are healthy, low sodium, rich in nutritional content, and we've done that with the help of a third-party nutritionist. And with several insurance companies, we have launched programs where the insurance companies incentivize their members to eat healthier by offering a discount of 10 or 15% on the healthy food choices. And the way it works is a customer swipes their health insurance card at the point of sale and receives the discount instantly on those food products, and then we bill the insurance company on the back end for the difference. We've run this program with one company for the last 3 years and have seen a lot of engagement and improvement in their members in terms of their diets. And then in the diabetes space, we have rolled out a brand called Rely On that covers all the different products that our diabetic customers need, and offers them the same high-quality products that are available to them through branded manufacturers, but at a fraction of the price. And finally, on the right side, you'll see the Pursuant Health kiosks, which are interactive kiosks that we have in about 3,000 stores, where customers can sit down and have their blood pressure measured, they can get an eye exam, they can get a body mass index score or a health risk assessment. And these kiosks every year see 32 million visitors sit down on average for about a minute and a half to get their readings. And then a lot of our communities represent the only access point for healthcare that those customers have. So next slide. So up until now, what I've tried to do is give you a sense of this emerging trend around retail health and the need to engage customers around healthy behaviors, right? And I've spoken to what are the underlying factors driving that trend, you know, which is lack of access, whether that's geographic or cost-wise or practical, to healthcare services. I've spoken to how Walmart is really taking steps to tie our offerings together to create comprehensive solutions. And I've given you some examples. I now want to speak to the health fair, the America's Biggest Health Fair program, that we launched last year but are now quickly learning to turn into a more frequent, regularly scheduled program. And so last October, on October 15th, what we did is we invited nurses to come into all of our stores, or the majority of our stores, and over a 4-hour period, simultaneously in the U.S., in all 50 states and Puerto Rico, we offered free blood pressure and free glucose screenings, and in states that permitted, also free vision screenings. What we saw over a 4-hour period, where almost just shy of 300,000 screenings, and based on public health models, we estimate that about 3,000 customers who didn't realize they were diabetic learned for the first time that they might be, and about 7,000 learned that they might have hypertension. And I want to give you some examples, some real customer examples. For example, we had a customer in Georgia who had a blood pressure screening, and her blood pressure was so elevated, she had a level of 255 over 160, that the pharmacist immediately called 911 and the customer was taken to the emergency room, and the customer's family told us, you know, afterwards, that those actions potentially saved her life. Another example was from a customer, a married couple, or the husband received a health screening at the event, and the numbers were off, and so he scheduled an appointment with his doctor immediately. Well, when he went to visit the doctor, it turned out that he had cancer. But the good news is, because they detected it early enough, they were able to treat it immediately, and the customer and the patient are fine. However, if they had waited a few more months, then it would have been there would have probably been a different outcome. So the last thing on the health fair, on America's Biggest Health Fair, I want to speak to is we also offered immunizations, and in that 4-hour period did 52,000 immunizations. And what was interesting is that 44% of individuals receiving their immunization that day were new to the Walmart pharmacy. So it goes to show that doing what's right for the customer and helping the customer and helping our communities also can be good for the business. Next slide, please. And the last example, or the last program I want to speak to you about, is going back to our Healthcare Begins Here initiative, which is really about helping our customers navigate the American health insurance system, which is very complicated. And where you have, for example, for seniors, so individuals 65 and older, a government program called Medicare. And then for individuals under 65, you have government programs called Medicaid that are sponsored by states. And then through the Affordable Care Act, that's what ACA stands for, you have subsidies and tax incentives for customers that earn under a certain amount so that they can get insurance. So long story short, it is complicated, and what we have created is a one-of-a-kind solution where we have independent insurance agents in stores, in about 2,500 stores, during the open enrollment period, which is typically from October through December. And these agents are helping our customers select the right plan that meets their needs. And we set it up so that we have the insurance agents, but we also offer that service online and through a call center, so that we're really offering an omni-channel solution to our customers so that they can educate themselves and engage in any way they like. And I'm proud to say that this past year, which was our second year of hosting this program, we doubled the number of enrollments that we saw through this program, and are making some significant investments and improvements to continue to expand this program, because we're listening to our customer, and our customer is telling us that they need help with this. And so, you know, I want to close with a call to action, which is if you are in the United States and you'd like to be part of America's biggest health fair, or a solution really that combines different aspects that we have in our stores to create simple solutions for our customers, let us know. We have opportunities during the health fair to demonstrate healthy food and healthy product options. We work very closely with insurance companies to create interesting solutions that might for their members, and would love to speak to you or learn about your ideas and perhaps create solutions together. But really, what I want to leave you with is this trend is here to stay. We don't see it. We don't see it changing anytime soon. The need and the demand from customers is big and growing. So thank you very much for allowing me the time to present today. And Sharon, maybe I'll stop there and open it up for questions.
Great, thank you very, very much, Alex. And if I can have my call to action as well, I want to reiterate Alex's call for engagement and to get involved from the CGF perspective. This pillar, and Walmart is a member of our steering committee. We have a number of working groups. We have lots of opportunities for engagement. We really want to help you to implement the resolutions and commitments that we have set. We measure our progress and we report on this publicly every year. So if you're listening today and you're thinking, okay, I have some great best practices in my company, or I'm getting started in specific areas and I'd love to share this with the membership, or I'd love to get involved, just reach out to me and we will make sure that we can get that set up. So if you do want to get involved, please do reach out to Alex and myself. So what we want to do is open it up for questions, and what I'll do is we have the chat box on the right-hand panel of your screen. So if you have a question for Alex, let me know, and I have already received some questions by email. So what I'll do, Alex, I have some questions and some remarks. I'll go through those first. So first question, Alex, I'm not in the USA. How can I get involved in what you're doing outside of the US market?
Oh, that is an awesome question, Sharon. Thank you so much for sharing that. And so I think, so look, what we're trying to solve for and the help we're trying to offer our customers, these are not American issues or American problems, right? Diabetes, hypertension, chronic diseases are really matters that affect our customers everywhere. And so I think that that absolutely, doing a health fair, for example, well, you don't have to, you can do that in any market, and you can find, I think, innovative solutions. Maybe partner with a national hospital system, maybe partner with the government, right, to offer like a free screening day in stores. I think you'll see great engagement from your customers, and they will appreciate you. I remember speaking to a colleague from the United Kingdom, where, as you know, has a very, very robust, very well-functioning national health system. But listen, my colleague was thinking that even in the UK, sometimes there can be like access issues, and so offering certain services at retail would be really appealing to customers, because at the end of the day, what you're trying to do is you're trying to make it easy, right? You're trying to remove any barriers for folks to engage with their health, and on these events are like, think of them as your public health early warning system. The reality is you can't, you really can't take action unless you know that there's an underlying issue, right? And so that's where events such as these, I think, really can play a key role across all markets. Thank you, Sharon. That was an awesome question.
Great, thank you. Another one I've received by email, Alex, if you could give some more details on what about personal care, looking better, feeling better, better aging, for self-esteem, skin care, prevention of sun damages, so the whole area of personal care, well-being, and looking and feeling better.
I love that. Thank you. That is awesome feedback and awesome thoughts. And as a matter of fact, we're starting to think like that. And so we are looking to get into a cadence of offering these types of events on a more frequent basis. As a matter of fact, we just had another event on March 13th. And the focus of this event was really on associates. And so for the first 90 minutes of the day, the nurses were in the break rooms and were offering screenings exclusively to associates and their families. And associates is what at Walmart we call our employees. And so we're looking to do additional events, perhaps quarterly, and where certainly, in the future, there could be an event, as you suggested, around personal care or beauty, and so I think it makes a lot of sense to incorporate that, and frankly, it also opens up kind of creativity, right? And it's just a new way of engaging, and a great way to engage the customer.
Okay, and what I can do, Alex, is I can connect you with the person who's interested in following up on the whole personal care, englobing that into the program. So I'll make that connection. I have more questions coming in. Hi, Alex. Do you have good examples of partnering with manufacturers on this healthcare service program in the US?
Absolutely. And so, So some of the partners that come to mind that were really sponsors of this event and then also demonstrated some of their healthy products, Procter & Gamble, Bayer, Pfizer, you know, are examples of companies who really stepped in and made the event possible. And I'm going to apologize to any companies that I've left out. There were a lot of sponsors, and we're extremely grateful for them. And so yes, I think there were a lot of opportunities for sponsors to get engaged. There continue to be a lot of opportunities for manufacturers to come in. For example, on the diabetes side, we have several companies that supported the program by offering, you know, their devices for the testing, or for the glucose testing, or for the blood pressure tests. And so I think those are some examples. And I'm certain, you know, if there's other opportunities that you see, that we'd be more than happy to take a look and see how we might be able to incorporate it into the program.
Yeah, thanks. And Alex, I have more connections for you as well. Susan has a comment about diabetes. Just what you've just mentioned, the diabetes screenings also help identify people who are at risk, pre-diabetic risk, type 2 diabetes, and Susan would like to connect with you on what they can do and collaborate with you on diabetes. And as many of you know, World Health Day by the World Health Organization this year is on diabetes. So we're looking as well to see how we can support that as member companies of the Consumer Goods Forum. And I think Walmart is doing a great job, and Susan points out that 86 million Americans are at risk of type 2 diabetes and pre-diabetes, and I'd love to see some synergies with health fairs and referring people into prevention programs. So I'll connect you and see what can potentially be done to drive that even further.
Well, I can't wait to connect with you, Susan. Thank you so much.
I have another question on obesity prevention, Alex. Are you doing something in the area of obesity prevention, or how do you see that in your health and wellness strategy?
So I think obesity prevention cuts across health and wellness, and then cuts across health and wellness and food, especially fresh, and how can we incentivize customers to eat healthier? How can we make it easier for customers to identify healthy food options? I'd say we're scratching the surface, Sharon, on that. You know, I spoke about the Great For You initiative, where we have labels that help identify the healthy food options in store, but we can do a much better job of making those labels bigger and more kind of predominant in the grocery aisle, and we're looking into testing that. We've done some interesting pilots and programs with insurance companies, right, where they are actually incentivizing and paying discounts on healthy foods. To me, those are very interesting kind of private partnerships, right, that we want to try to leverage a little more aggressively, and then look at how, you know, how can we get suppliers and manufacturers involved. And so I'd say it's a hot topic. It's of great interest, and there's much more we need to be doing. So if you have ideas, please you know, let us know, because this is a critical area. And again, not just for the U.S. market, but frankly for all the markets that we're in and that CGF's in.
Yeah, absolutely, and it's definitely one where, I mean, we see in the health and wellness pillar, it's not a subject that any one person or country or company or institute can go alone on this. It really has to be a a multi-stakeholder and collaborative approach. So yeah, if there are ideas, please reach out to us. We have plenty of initiatives ongoing, but we're always, as Alex said, we're scratching the surface. Next question I have for you, Alex, is what's the key to getting your employees involved and engaged in such community actions?
Oh, that awesome question. I'd say it is, so I'm going to answer that question in two ways, right? The first is, let's say, the associates who function as, let's say, a provider in this, so the pharmacists or the techs that are really offering, that are really part of making the event happen and offering the service to customers. And surprisingly there, if you can give folks kind of a little bit of direction in terms of, hey, these are best practices and how to set it up, and this is the type of impact that you can have in your communities, that's really all it takes, with a lot of associates to get them really fired up about being able to take something like this to their communities that they serve and really make a difference there. There is then, though, also the aspect of, how do you engage your associates to take advantage of the screenings and take steps towards leading a healthier lifestyle, right? And that's very similar to engaging customers, right? It's really got to be about, making access super simple and easy, and offering it, I think, on a frequent basis, so that if you missed it once, or if you were kind of shy the first time, the next time around maybe you'll be able to take advantage of it. But then most importantly, I think it's not good enough, right, to offer just the screenings or just, kind of that initial step. I think unless we can put together then comprehensive solutions to help folks on their journey, we're not doing our jobs. And so while I think, this is all a nice starting point, there's far more that we've got to do.
Great. And that's, so do you have another follow-up on the area of associate health and wellness? Do you have a specific health program for your staff?
Mm-hmm. Yeah, we have we have several things, but the one I'll talk about briefly is a program called ZIP, and it's essentially built around the philosophy of, if you can help individuals identify, make their own goals, and kind of, their set realistic expectations on how or what they want to improve, and then help create, small incremental, help them make small incremental steps that over time can lead to dramatic change. That's really the philosophy around ZIP. And so it's a program that's available in all stores, where you identify, you can set your own goals, and then you can build your own plan to achieve that goal, and you can submit your kind of goal and plan to a third party that helps us organize the challenge, and then the top challenges across the country can win prizes. And so it's really grassroots, and has proven very effective, and at the at the heart of it, it's just super simple, right? So that's one that we have we've been we've been offering and expanding and making improvements on over the last 3 to 4 years. And if you're interested in that, there's a colleague on our benefits innovation side that can that has really spearheaded this exciting initiative that I can connect you to.
Yeah, we have some great best practices actually from our employee health and wellness work stream, our associate health and wellness work stream. So there's plenty to share, I think, among CGF members and see what's going on. I have, it's not a question, but a comment for you. So very impressive and consistent approach and program, and congratulations to Walmart for this impressive program.
Thank you.
And I believe that is everything I have received by email. We just have a minute left. If there's any final questions, let me know. And if we didn't get to your question, we'll absolutely follow up with you after the webinar by email. And for those who are interested, I'm happy to make the connections to see how we can continue sharing best practices. So I think we're okay. Or if anyone wants to raise their hand to take the microphone, please let me know. We have one minute left. Otherwise, we'll follow up with you directly after today's webinar. Okay, so I think we're good, and we will, as promised, follow up and connect you with Alex. And you can see on our screen here is our website, so tcgfhealthandwellness.com, where you can find a lot of information and about what we're doing at the Consumer Goods Forum. And we also have a website, consumergoodsforbetterlives.com, where you can find good practices, best practices, companies who are getting started on many of the areas that Alex mentioned on today's call. And where if you have an idea or you'd love to host a webinar today for the CGF membership, just let us know, and we'd be very happy to set that up and share your story. So Alex, on behalf of everyone on the line today, I want to say a big thank you, and it's great to share these stories and really see the amount of people you're touching every day in your stores. So keep up the good work, and thank you very much for sharing this with us today.
Thank you so much, Sharon.
Thank you very much, everybody. Take care. Bye-bye.